Kennel cough, causes, symptoms, and prevention tips. Explore the kennel cough in this comprehensive video. Causative organisms. Kennel cough is caused by Bordetella bronchoseptica bacteria and viruses like canine para-influenza and adenovirus. Vaccines. Vaccines target Bordetella bronchoseptica, canine para-influenza, and canine adenovirus, recommended in high-risk environments. Prevention steps. Maintain hygiene, isolate infected dogs, ensure ventilation, and regularly clean and disinfect shared spaces. Symptoms to watch. Key symptoms include a persistent cough, sneezing, nasal discharge, and, in severe cases, respiratory distress. Incubation period. Kennel cough's incubation period is 2 to 14 days, with infected dogs potentially spreading the disease without showing symptoms. Transmission. Highly contagious, kennel cough spreads through respiratory droplets, direct contact, and shared items in enclosed spaces. Treatment. Most cases resolve on their own. Severe or prolonged cases may require veterinary attention, including antibiotics and supportive measures.